Hello, and welcome to a review of the safety profile of Tirzepatide. My name is Bharati Bhardwaja, and I am the rheumatology clinical pharmacist for Kaiser Permanente Colorado. So let's go ahead and kick things off for this safety review. The most commonly reported adverse drug reactions are gastrointestinal reactions and include abdominal pain, constipation, decrease in appetite, diarrhea, indigestion, nausea, and vomiting. Common adverse drug reactions that are also reported with more than 5% of an incidence in patients include injection site reactions, hair loss, and fatigue. Moving into drug interactions. So with Tirzepatide, it lowers blood glucose. And so it's important to consider reducing the dose of co-administered insulin or insulin secretagogues like sulfonylureas to minimize the risk for hypoglycemia. Tirzepatide also delays gastric emptying and could have a potential impact on the absorption of at-risk co-administered drugs. So this is really important, especially for medications that have a narrow therapeutic index like warfarin that may need closer monitoring at the time the drug is started. A potential drug that comes to mind that could possibly be impacted by the delay in gastric emptying is mycophenolate mofetil, which is used to treat rheumatologic conditions such as lupus or interstitial lung disease. While there are no formal drug interaction studies on the combination of mycophenolate mofetil and Tirzepatide, there are some studies suggesting a possible impact of delayed gastric emptying on the pharmacokinetics of the active metabolite mycophenolic acid. While there is a definite need for further study on this, it is important to closely monitor for any changes in disease activity if using this combination. And it may be possible to consider a switch to the enteric-coated mycophenolic sodium formulation, which bypasses the stomach and releases the active metabolite in the intestine. And lastly, for patients using oral hormonal contraceptives, it's best to switch to a non-oral contraceptive method or add a barrier method of contraceptive for 4 weeks after starting Tirzepatide and for 4 weeks after each dose escalation. Moving on to the safety profile of reproductive health, and in patients who are pregnant, it's recommended to discontinue if pregnant as it may cause fetal harm. Pregnant patients exposed and healthcare providers who are aware of this exposure should contact the drug company at the phone number provided here. For lactation, it's best to have a discussion to weigh the risk and benefit of breastfeeding, as there are currently no available data on the effects of Tirzepatide on breastfed infants or on milk production. And lastly, some high-level key takeaways displayed here for the storage and specific recommendations on the best use by date depending on storage in the fridge or room temperature. And these recommendations can all be found in the prescribing labeling for each of these brand formulations. And this concludes the review of the safety profile of Tirzepatide. Thank you for listening, and for more educational content, feel free to visit online at WRAP Content Room, or you can access it through the WRAP ACE app. Thank you.